welcome all to this new edition of the Immuno Paper of the Month. We are Javier Rodriguez and Aurélie Nange from the Euler Immunite Journal Club team. So welcome, Aurélie.
Hey everyone, today we're going to discuss a paper recently published in Arthritis Research and Therapy, and it's our real pleasure to introduce the first author of the paper, Dr. Maria Sokolova from Department of Internal Medicine, Rheumatology and Immunology, Friedrich-Alexander University, Erlangen-Nuremberg, Germany.
Hello Javier, hello Aurélie, thank you for having me. It's a great pleasure to be introducing our research paper of the month for you today.
So welcome, Maria. Actually, it's our pleasure. So your paper was selected for this paper of the month edition. So congratulations. And thank you very much for your time and for sharing your results with us. So let's start. Can you please introduce the title of your paper?
Yeah, sure. The title is a bit long. So it's a set of serum markers detecting systemic inflammation in psoriatic skin, entheseal, and joint disease in the absence of C-reactive protein and its link to clinical disease manifestations.
Thank you very much, Maria. It sounds really interesting. Let's start with the question. So I'm going to start with the first one. Could you please summarize for us in simple words, which are the main findings of this work?
Yeah, so this study was designed to test the possible set of biomarkers in psoriatic disease and to look at patients with different clinical presentations, how these biomarkers behave, do they reflect these disease manifestations. And our final set included 5 biomarkers. So we had beta defensin 2, lipocalin, IL-22, IL-8, and calprotectin. These were the final 5. And we found out that patients with only skin presentation, they were more often positive for beta defensin 2 and lipocalin 2, whereas patients with joint manifestations had more often elevated calprotectin and IL-8. And IL-22 was more equally distributed between disease manifestations. We also had entheseal disease. And then we also could check in a small cohort of patients whether these biomarkers decrease upon treatment with TNF inhibitors and IL-17 inhibitors. And we saw indeed the decrease of all these biomarkers upon treatment after 6 months.
Okay, so thank you very much, Maria. It looks actually like a very complete and very comprehensive study. But let's start with a big first question. Why do we need alternative biomarkers to CRP?
Yeah, so biomarkers are tricky. And to be honest, in rheumatology, we don't have so many reliable biomarkers at all. So we had autoantibodies that are relevant for some diseases for diagnosis, and of course we have CRP, that is like the biomarker to look at the disease activity and activity of inflammation. And we have major problem here in psoriatic disease because we don't have autoantibodies, and as any clinician knows, at least in 50% of patients, maybe less, we don't maybe more, we don't see the elevated CRP levels when they're active or whatever. And partly it's because of probably IL-6 that is not playing a major role in the pathogenesis. And therefore we don't have this apparent acute phase response. And there have also been shown exacerbations of disease after exacerbations of psoriasis on tocilizumab. So, and therefore we need reliable biomarkers that could reflect what's going on with the patient.
Yeah, this is really interesting. But among all the biomarkers that could have been chosen, why would you choose the ones you actually decided to study?
Exactly. So our approach was not to just test all known markers of inflammation known to humanity to see if they pop up. So from the beginning, we had the candidates that could be connected to the disease pathogenesis, and all of them actually have been proven to be relevant for pathogenesis of psoriatic disease. And in a smaller cohort of patients, we tested a lot of them. And then after this first phase, we chose these 5 biomarkers that were elevated in the smaller cohort and further explored them. Yeah, that's.
Okay, so it looks like many pieces are linked in this aspect. I would like to go to a question about the therapy. So your results point to an effect of TNF-alpha and IL-17 inhibitors of these biomarkers. So I would like to know why have you decided to go for these therapies, and which were the main effects? And also, do you find any difference between these two approaches?
Yeah, so we chose basically 2 different pathways. TNF-driven axis, and we had patients at baseline, and then after 6 months of treatment, and we saw decrease of these biomarkers for both therapies, but it seemed that betadefensin-2 and lipocalin-2 were more potently decreased upon IL-17 inhibitors. And that actually makes sense because IL-17, these 2 biomarkers, they are driven by IL-17. So they have been shown to be IL-17 target genes. So that makes sense that they more potently were decreased upon IL-17 inhibitors.
So to move further with these biomarkers, very interestingly, at the beginning, you mentioned that you could see difference between biomarkers depending on disease phenotype. Could you elaborate a little bit on that?
Yeah, so we had groups of patients with isolated disease presentations. And the main disease presentations in psoriatic disease are skin, joint, and entheseal. And we had these separate 3 groups. So the first group were patients with psoriasis, but they were carefully examined to not have any other apparent disease manifestations. Then the second group were patients with psoriatic enthesitis. So it was proven by SPARC index, and it had to be proven by either Doppler or MRI, at least at one entheseal point. And they also were not allowed to have skin or arthritis. And the third group were patients with family or personal history of psoriasis and with arthritis. And then we had some mixed groups with 2 or 3 presentations mixed. And we compared the biomarkers. And what we saw was that these 2 IL-17 target genes, betadefensin-2 and lipocalin-2, they were more often elevated in patients with active psoriasis, which has also previously been shown. These 2 biomarkers have been shown in patients with psoriasis. And then we had IL-8 and calprotectin, which are innate immune activation molecules elevated in patients with arthritis. And IL-22 was a player in between in all 3 disease presentations. Also, what I wanted to say about our choice of biomarkers is that we know that in psoriasis we have innate immune activation and T-cell activation as an underlying pathogenesis. And we wanted to find biomarkers that would reflect these pathways and to investigate them. So that was also the bottom line.
Okay, so these results are really promising. So looking at the future, do you think that these biomarkers may be useful to predict disease trajectories, such as good treatment outcomes, or maybe disease progression from one phenotype to other? What do you think?
It's actually a complicated question, because, like always with biomarkers, because I think, for example, if you want a biomarker that will correlate with disease progression, you will need a biomarker that will ultimately be linked like completely to the disease pathogenesis, like for example ACPA for rheumatoid arthritis. And for these biomarkers, we know that they are linked, but how strongly they are linked, we don't know yet, and we will have to look into that. But for example, in case of beta-defensin 2 and lipocalin-2, in our study, in the previous studies, it has been shown to correlate quite well with PASI, which I personally find very nice, because if you look at our graphs, you will see that 0% of patients with psoriasis had elevated CRP. So CRP was elevated only in a subset of patients with arthritis. And about treatment response, I would say that we will also need, and I think we will definitely look further into that, because this study already showed that at least these biomarkers decrease upon treatment. But whether, for example, baseline levels will predict the treatment response, it's at the moment, we cannot say if it's true or not.
Okay, this sounds really interesting. I was wondering if you had insights on what would be the next step to allow the translation of your work into clinical practice?
Yeah, so I think it would be really nice if we could show in the future that these biomarkers, maybe some other biomarkers also, can really be a help for making treatment decision for a patient. Because we saw a lot of patients who are CRP negative and they still have these biomarkers elevated, and when we know now that they're likely to reflect certain disease pattern, we can also maybe try to predict, or we will at least know that, okay, this patient may be not in complete remission. But we, of course, need a larger number of patients and a little bit more time to say that definitely, but I think it would be a really nice alternative.
Okay, that's really promising, and I am looking forward seeing more work on this. So we are getting to the end of this interview. Thank you very much, Maria. We would like to congratulate you again with all your co-authors for winning the Paper of the Month poll, and thanks again for presenting your results in such a clear manner in this interview, and to collaborate with Eminet.
Yes, thank you. That was so nice. Yeah, thank you.